My name's Mia Schneeweiss. I'm the senior author on the research team from Harvard Medical School and Brigham Women's Hospital with the Division of Pharmacoepidemiology, and we recently studied the occurrence of inflammatory bowel disease in patients with chronic inflammatory skin diseases. As you may know, immune-mediated diseases can often overlap and can greatly increase disease burden for patients. Several studies have linked chronic inflammatory skin diseases with inflammatory bowel disease in a range of data sources, resulting in some mixed conclusions. Better characterization of IBD across skin diseases could lead to earlier identification and treatment of IBD and can help contextualize inflammatory bowel disease signals that may be reported as adverse events from medications. In this cohort study, we used insurance claims data from the US. We compared the risk of inflammatory bowel disease in patients with inflammatory skin diseases versus similar patients without those skin diseases. We identified adults and children who were seen by a dermatologist in the US between 2004 and 2021, and who were diagnosed with either psoriasis, atopic dermatitis, alopecia areata, vitiligo, or hidradenitis suppurativa. Comparator patients were selected if they were examined by a dermatologist but not diagnosed with an inflammatory skin disease that we're looking at. In order to really capture new IBD, we excluded patients who already had IBD. Patients were followed until they either got an inflammatory bowel disease diagnosis, died, disenrolled from their health plan, or had an end to their data stream, whichever came first. With a median follow-up time of 2 years, and after applying propensity score adjustment for IBD risk factors that may be different between our comparator groups, we observed a twofold increased risk of both ulcerative colitis and Crohn's disease in patients with hidradenitis suppurativa. We also observed a 35% increased risk of Crohn's in patients with psoriasis, but no increased risk of ulcerative colitis. Neither ulcerative colitis nor Crohn's disease was increased in patients with atopic dermatitis, alopecia areata, or vitiligo. As we understand that multiple diseases linked to the immune system may co-occur, this study points towards an increased risk of newly occurring IBD in patients with hidradenitis suppurativa and of newly occurring Crohn's in patients with psoriasis. In treating these patients, dermatologists may think about considering IBD as a comorbid condition or co-occurring condition that can adjust treatment as needed. Modern biologic treatments may also alter the incidence of IBD, and having a national representative background rate will help make it easier to identify and contextualize potential signals.